The phone lines will be open soon, so if you have questions concerning mini dental implants, I encourage you to get your phone and give us a call, because we've got Dr. Ackerman here from Freedom Mini Dental Implant. Welcome back to the show, Doctor.
Hi, thank you.
So this is something that you have just really focused in on and specialized on, and I think we were talking about this right before we came on air, and I think it's really encouraging for anybody that might be considering this procedure. This is something that, this is what you do,
yes.
right? So you are just an absolute wealth of knowledge.
Yes.
You have the reps down. You are doing this day in and day out. And I'd love for you to tell people a little bit more about the process and procedure when it comes to mini dental implants.
Yeah, definitely. So first, just to kind of hit on, I am a general dentist, but pretty much the only procedure I do now are mini dental implants. So I'm placing mini implants daily. I do, 1 to 2 cases a day. So yeah, I've gotten pretty good at it because that's all I do. And the mini implant, we call it a mini just because it's a smaller diameter implant, so it's a lot less invasive, a lot less healing time, and usually a lot less costly than the big surgical implants. And since it's a smaller diameter implant, it allows more people to be a candidate for implants. So some people have been told maybe they didn't have enough bone for the surgical implants or had to have bone grafts or sinus lifts, and I'm able to sometimes place the mini implants and not have to do those procedures and save you money and time, and be able to replace teeth or get rid of that denture completely, or stop using denture glue with the mini implants when maybe you thought you weren't a candidate and didn't have an option.
Yeah, so this is an all-around, if you're going to be apples to apples comparison with dentures, this is just a way to not only save a lot of time, additional maintenance and steps in the process as far as just getting ready to live your life as normal. This is a way to really just like get a lot of your life back, your time back,
yes.
and have a more secure denture
yes.
in general.
Yes, so many people struggle with dentures. I hear it all the time. They don't like to go out to eat anymore because they can't order anything off the menu, or they're embarrassed their denture is going to fall out. So definitely people struggling, especially the lower denture. That's the one I hear people complain about the most. It just flips and flops. You don't get any suction from it. So we can place the mini dental implants, and then your denture can snap on to the implants, and then you don't have to use denture glue anymore. You don't have to worry about it flipping and flopping. You can eat better foods. So that's one of the most common things I do, is a snap-in denture. And a lot of times people have a denture that it looks good, they like the way it looks, it just won't stay in and function. And so sometimes I'm able to use your same denture and save you money that way, and just convert that denture to a snap-in denture.
That's amazing. And this seems like something to me that the sooner you're having these conversations, the happier you're going to be in the long run,
yes.
right?
Yeah. So many people, put it on the back burner, don't think it's going to work for them. So yeah, definitely, it's a free consultation. So all you have to do is call my office. It's a free consultation. We do a 3D X-ray, and that's at no charge, because I like to have the information, and I want to know that you're a candidate for the mini implants. I'm the only dentist there. We're a small office, so you will see me and me only. I will be doing all the treatment. But yeah, it's a free consultation. So if you've been thinking about it, the sooner you come in for the free consultation to see if you're a candidate, we'll go over costs, the sooner you can, eat again and not be self-conscious about a floppy denture.
Yeah, so not only are you getting a lot of your life back, some convenience aspects as far as just being able to talk and eat, and just in general the overall function of using your mouth, which is obviously something everyone's using every single day.
Yes.
There's also a lot of potential health benefits to converting to a permanent dental implant.
Definitely. I actually just had a patient come in today and said, all the foods that are bad for you are easy to eat. All those sugary foods, they're mushy, and, she had failing teeth and couldn't chew. She's like, so, I'm unhealthy, I'm gaining weight. All the good foods that are healthy for me, carrots and steak, I can't eat. So that's where our implants definitely come in, to be able to eat all those healthy, nutritious foods again. And, we've talked a lot about the snap-in denture, but we can also do permanent teeth, where one of the things people complain about the most of a denture on the top is they can't taste their food anymore. And when I do the permanent teeth, there's nothing on the roof of your mouth anymore, and you get to taste food again. Yeah,
and there's also the link between, as you lose teeth, the chance for just gum disease and things like that to really actually play a longer term detriment on anyone's health is coming into play at this point too. I'd love for you, we're talking about how minimally invasive this is, and if you watched Dr. Ackerman before on this show, you've seen how minimally invasive it actually is, but I'd love for you to go over how much different it really is from the traditional surgical implants that people might have heard about.
Yep, certainly. So I guess I'll start, this model definitely speaks volumes on the difference in the mini implant versus a surgical. It's kind of hard to see sometimes, but so when I place an implant, I will, just numb you up, local anesthetic, because I'm not doing any incisions or stitches. And there is a small hole here that is hard to see, but that is the pilot hole, the little hole that I have to make to place an implant. So imagine this is, your jawbone. I'll numb you up and make this little hole through the gum into the bone. And then the mini implant is just a little one-piece titanium screw that screws into that hole. So a lot less invasive than this big hole, which is the more traditional surgical implant. So the mini implant with the smaller hole heals up faster, a lot less invasive. I don't have to have as much bone to place an implant. I just have to have some bone. So it really helps people that were told they weren't candidates for implants, that they could still be a candidate for a mini implant. So that's one of the biggest differences, just, the diameter in the mini implant, making it a lot less invasive.
And you're able to really customize this to everybody too, because not everyone is looking at necessarily a full replacement or needing everybody's going to have a different situation.
Yes.
Is the short of that.
Yeah.
I'd love for you to kind of talk about how you are able to then further customize the right fit, the right denture for different people.
Yeah, so everyone's situation is different. Some people may be missing all their teeth, which we've talked about a lot, and I know we'll show the models later, the snap-in denture. But some people, you may just be missing one tooth, or you may be missing, 2 teeth in the back and want to be able to chew again with your molars. And we can certainly replace just 1 tooth or 2 teeth or 3 teeth with the mini implants. It doesn't always have to be, all your teeth or a denture. It could be 1 tooth that maybe, you had a car accident or a baseball sports injury, you lost 1 tooth. We can certainly replace, 1 tooth. And everybody's situation is different, so that's where the consultation comes in. And, we'll take that 3D x-ray. It's no charge, and come in for the consultation, and then I will, do an exam, take a look. We'll talk about your priorities, what you're wanting to accomplish, and we'll certainly go over a treatment plan and costs.
I want to hear some of the things that you hear from your patients. Before we had the conversation, Dr. Ackerman, I wasn't able to do this. I wasn't able to eat this. I'd love to hear the things that just make you feel that reward, that you're able to give that back to your patients.
Yeah, certainly. I mean, it's definitely emotional. Just this week we did cemented the permanent teeth up top, and there were definitely tears of joy. And she was like, I was just so. She said, I didn't expect to be this emotional, but this is life-changing for 2 reasons. One was, a lot of aesthetics. Sometimes, teeth are failing, people trying to hide their smile, and she no longer felt like she had to hide her smile anymore. So that was very, very rewarding, especially, I had a patient today come in and it was like, I need to go on job interviews and I need to be able to smile and be confident. So definitely aesthetics and looks can be life-changing, but definitely as far as eating, steak is probably the #1 thing that people are always like, oh, I can eat a steak again. Carrots, salads, just things that they couldn't eat anymore or they avoided because they could not function with, either their failing dentition or struggling with dentures just moving and flopping.
Yeah, you don't realize what you've been missing out on or what you could be missing out on until it's taken away from you. And then to be able to get it back has to be such an amazing experience, and an experience that anybody watching right now that might be considering that if dental implant surgery is right for you, if you're already wearing dentures and you just want to have that free consultation, we really encourage you to reach out to Freedom Mini Dental Implants. We are going to take a short break, but we are going to be back with a lot more information from Dr. Ackerman, so please don't go anywhere. We will be back right after this short break. If you are ready to have your most confident smile back, I'm really excited to be able to talk some more with Dr. Regan Ackerman, Freedom Mini Dental Implants. We were talking about right before the break about how much this can really give people's lives back, and I think it's so encouraging that people who maybe have been living that day-to-day life with dentures and the daily maintenance of it all now have an opportunity to take their life back in a lot of ways. I'd love for you to just keep going a little bit more on the technology behind what you're able to do and how it's so impactful and life-changing for the people that you get to work with.
Definitely. So I think one of the best ways is, showing the models, because it definitely kind of explains and shows. So this is one of the most common procedures we do, which is called the snap-in denture. So a lot of people, like you said, struggling with dentures. So many people come in with their dentures in their pockets because they don't wear them anymore. So this snap-in denture allows you to start wearing your denture again. So imagine, this is your mouth, your gums with no teeth. And then these are the mini implants. They're just, a small diameter implant. And when I place these, I'm just numbing you up with local anesthetic, a little Novocaine. I don't do sedation because I'm not doing any incisions or stitches. I'll numb you up, make that little hole through the gum into the bone, and then this is a little titanium screw that kind of screws and torques into the bone. And then the great thing about the mini implant is the same day that I place these implants, I can now put these attachments inside your denture. And so that day that I place the implants, you will leave with the denture snapped on to the implants. So no more denture glue, no more floppy denture. Your denture is going to stay in. You can eat more. You'll wear it pretty much 24/7, but you're going to snap it out once a day, rinse and clean it, and then snap it right back in. And definitely, like, this is for the top. A lot of people struggle because of that gag reflex on an upper denture. So once implants are in place, then I can trim that back some so that it doesn't gag anymore. That's one of the biggest reasons people don't wear their upper denture. So the mini implants definitely can help get you in a better situation, upper or lower denture. But the biggest advantage of the mini implant, a lot less invasive, usually about a third to half the cost of the surgical implants. And the same day that I place these implants, you will leave with your denture snapped on to those implants. So it's just a great way to be able to function again with your denture.
You mentioned being able to like curb the gag reflex a little bit, but that the roof of your mouth is still also a vital portion of tasting and enjoying a lot of foods and things that you drink, and being able to have that customization, I'm sure, goes a long way in just being able to enjoy food again.
Definitely,
right?
Yeah, and you can't trim that back unless you have implants, because if you try to trim an upper denture back without implants, then you lose a lot of suction and it just really won't stay in. But some people just can't tolerate it because of their gag reflex, and that's where getting the implants, and especially the mini implants, just a lot less invasive, easier way of doing implants.
I'd love to see some pictures of some of your happy patients, because I know we have some. I want to see some before and afters, because not only are you giving people functionality back, you're able to improve their smile and give them the smile that they remember having growing up.
Yeah. So I think we've got some before and afters.
Yep, they're going to load up here in just one second. But
so it's definitely amazing and life changing. And I see everyday real people. Just every day. This is Wallace, one of my patients. He came in. Missing a lot of teeth. The upper was the biggest concern. He knew they were kind of failing on him and he had to do something. So we ended up, he had to have all his top teeth taken out, and we did the permanent teeth for him. And I mean, life-changing as far as aesthetics and function. And for him, it was more about function than anything, but obviously got more aesthetics. We did go a little bit lighter, obviously shade on the top, because he doesn't really show his bottom teeth, and he wanted to do a little bit lighter top teeth. But definitely life-changing as far as, the smile and the confidence. And for him, the biggest thing was function. So, because now he's, got permanent teeth. So those are the permanent teeth. They don't come out. I know we'll show the model later, but he brushes those just like regular teeth, toothbrush, toothpaste, uses a water pick to keep them clean. But now he can chew steak again, bite into that juicy hamburger, corn on the cob, all that good stuff.
That is amazing, and it does have to just feel so much better. I imagine, like, just the health of the gums, everything about, we're talking mainly teeth, but like so much more is beyond the teeth.
Yes.
And I imagine being able to feel like my gums are healthier again, that having those sensations back are probably
definitely
something that people were missing and didn't realize how badly they were missing it.
And a lot of people, and I get it, they're trying to hold on to their teeth as long as they can, but like you said, their gums are infected and they're kind of just keep going in circles trying to get a tooth repaired or patched, and then it breaks, and they're just kind of tired of that endless cycle of trying to fix things. And once you get all the teeth taken out, majority of dentists will just say a regular denture, but I always say I can make the best regular denture in the world, but you're still not going to like it because you may have to use denture glue or paste. So that's where the implants come into play, and if you can do mini implants, it dramatically increases the functionality of a denture or being able to get rid of the denture.
Yeah. Before we go to this permanent model, please remind people that this is a free consultation, right?
Yes.
What are the steps to getting on your calendar?
Yep. So you just call the office and make an appointment. It's a free consultation. It's no charge. It's usually about a 30-minute appointment. When you come in for the consultation, we'll go ahead and take the 3D x-ray, and then I'll review that, come in, and you'll meet me and we'll discuss what your priorities are. I'll do an exam, and then I'll go over your options with you. I'll show you the models and the options, and we'll go over cost. The mini implant usually is about a third of the cost or half the cost, but we do have financing plans. We certainly offer those if you need to look at a payment plan, and we can help you do that in the office as well.
And we actually do have a call in with somebody that's got a question. We got a gentleman named Anthony on the line. Anthony, what do you have for Dr. Ackerman?
Yeah, I was just curious if I have type 1 deterioration in my jaw and starting to lose teeth, every other month now. And just wondering if that's an option that I could explore.
Yeah, certainly. Anthony, can you repeat, because I missed, you said you have type, and it went out on
1
me.
diabetes,
Type
and
1
it's
diabetes.
a lot of bone deterioration in my jaw.
Gotcha. Yeah, so no, certainly. I have certainly placed implants on a lot of people that are diabetic or have bone loss, or they've been diagnosed with that periodontal disease. So that's certainly not going to keep you from having the implants. So definitely, would definitely call and make the consultation appointment. There's a lot of people that I've seen that, they're losing their teeth because of bone loss or gum disease, the periodontal disease. And so they think they may not be a candidate because they've been told, of the bone loss and the teeth are getting loose and have to come out. But a lot of times there's still enough bone to be able to do the mini implants. So definitely a great question. I've placed many implants on, lots of people that, as long as you're kind of controlled diabetic, shouldn't be a problem. That's the kind of the great thing about the mini implant. It's so less invasive that even a lot of people with medical conditions, they may be on blood thinners or have other medical conditions where the bigger surgical implants may be too invasive for them. The mini implants are a lot less invasive and work great for those situations. So great question.
Yeah. Thank you, Anthony.
Yeah.
Thank you for calling in. We are going to take a short break. There's a little bit more time. If you want to get a question in for Dr. Ackerman, call now, and we will address that after we come back. We'll be here on Wave Lessons Live. Back again with Dr. Ackerman. Just a few more minutes for you to get your calls and your questions in for the doc here. Before we get too far ahead, I do want to make sure that we talk about, we showed the snap-on models and that is available to people, but we mentioned the before and after has a permanent model.
Yes, yeah. So the before and after picture, what Wallace had. So this is what we call the permanent teeth. So this gets rid of the denture completely. So it's a lot less bulky. Gonna place implants the exact same way, just numb you up, local anesthetic, no incisions, no stitches. But I'll place more implants, and then we have a bridge that's made out of a much stronger material than a denture. So with more implants in this stronger material, this will get cemented, kind of glued permanently onto the implant. So it doesn't come in and out anymore. It's kind of the closest thing to getting your natural teeth back. You brush it just with, regular toothbrush and toothpaste, and we give you a water pick, like I call it a power washer for your mouth, just to kind of flush the edge and keep everything clean. But then you really have nothing on the roof of your mouth, and you really get to taste your food. Really, your speech won't change because it's just the roof of your mouth. It just really feels more like your natural teeth, and it's cemented on so it doesn't come in and out. So you get rid of the denture completely with this option.
I think that's amazing as far as like that is what's truly going to get your life back to normal.
Yes.
You read my mind. I'm like, well, that seems like the best option to be just like as if your teeth never were lost.
Yes. Yeah.
So that's incredible.
Definitely the best option that we do.
So that's what are the, after this procedure is done and you have that denture in place, I imagine because of the minimal invasiveness, the recovery time once the denture's in place can be pretty quick, right?
Yeah, it's definitely less than like the bigger surgical implants. So the day I place the implants, because that's another question, as far as post-op pain, definitely a lot less than the big, surgical implants. Usually we say that first 24, 48 hours, you're still going to have some achiness to be expected from placing implants. But I always send you home with prescriptions and we go over post-op pain. Most people, may take the day off that we place the implants and maybe the next day. I've had a lot of patients go to work the next day, but most people take the day and the next day off, and then after that they're fine. So it's not, a week-long post-op pain procedure, so a lot less invasive.
Yeah, and just the fact that it gives you that flexibility and that freedom to get back to, like, in Wallace's case, just wanting to eat steaks.
Yep, just wanting to eat steaks again.
I think that's just amazing. So this is the first time I've gotten to talk with Dr. Ackerman, and I'm genuinely sitting in this chair just fascinated by a lot of what I'm learning. So this is really, really cool. I'd love for you to give one more, just, a chance for people to get on your schedule. What is the best route to do that, and how quickly are you looking at getting new patients in to have these initial consultations?
Yeah, so normally if you call, we can usually get you in within 2 to 3 weeks for a new patient consult. Obviously, it just depends on the schedule, but certainly all you have to do is call the office, even ask questions, then they can give you more information over the phone. Schedule a consultation. It's no charge. It's, free for the consultation. It's usually about a 30-minute appointment. We'll take the 3D x-ray. We'll, see if you're a candidate, see what your situation is, and go over, your options and cost, and see how we can help you out. So, yeah. Yeah,
and this is, again, a custom solution for you, the model that will make the most sense for your life and what you're trying to get out of your day-to-day use of your teeth and your mouth. So I think that's really, really incredible. What are some of the other, we've touched on it, and I just think it's so important to remind people what they get back from just having this conversation. What's on the line when it comes to having these dental implants is the fact that you are going back to the confidence level maybe that you didn't have, or you might be missing from missing teeth.
Yep. So one of the biggest things too, we've talked a lot about dentures, but people might be missing like just one front tooth, and I can use a mini implant to replace just one front tooth and get rid of a flipper or a partial, and then it gets cemented on permanently. So that's a huge thing. If somebody's missing a front tooth and they haven't been able to afford a bigger implant or want to get rid of that partial, to be able to replace a single tooth can be life-changing.
And is that where the mini dental is, the minimally invasive aspect of it? That, I imagine that's a game changer for those front teeth.
Yes, yeah.
Because I can look at this model and
like a year-long process, like the surgical implant is. If they've already healed up and they've been missing that tooth for a while, the day I place the implant, they'll leave with a temporary tooth on there and have a tooth and a smile again.
So it's that simple, folks. Make sure you please get on the schedule. Come see Dr. Ackerman. Go to freedomimplants.com so that you can be on the books. Make this happen as soon as possible. It's a chance to get a lot of your life back on track and back to normal before any missing teeth happen or have happened in your life. So Dr. Ackerman, thank you so much for being here. I'd love for you to, again, just remind people the best way to get on the schedule and set this initial consultation.
Yep, so just give the office a call, and we're right across from Valley High School on Dixie, and then actually starting next week, we'll have another location in the Fern Creek area, kind of on the corner of Bardstown Road and Hurst Fern. So we'll have 2 locations starting next week, but just please call the office. It's a free consultation. And like I said, we'll have 2 locations, one Valley Station area and one Fern Creek area starting next week.
Stop messing with those removable dentures. Get more stability, increase comfort, all around. Just you'll be happier if you make the call to Freedom Mini Dental Implant. We'll be back tomorrow on Wave Listens Live. Thanks for joining us.